Hi friends, today in this topic of ECG basics, I will talk about left atrial enlargement. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer the diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. Coming to left atrial enlargement. Left atrial enlargement is due to pressure or volume overload of the left atrium. It is often a precursor of atrial fibrillation. It is also called left atrial hypertrophy or left atrial abnormality. The ECG criteria for diagnosing the left atrial enlargement is we see broad bifid P wave in lead 2, we call it as a P mitral, and also there is enlargement of terminal negative portion of P wave in V1. So in lead 2 we get bifid P wave with more than 40 milliseconds between the two peaks, and total P wave duration is more than 110 milliseconds. And in lead V1 we get biphasic P wave with terminal negative portion of more than 40 millisecond duration, or we can say biphasic P wave with terminal negative portion more than 1 millimeter deep. So these are the changes which we see in the right atrial enlargement, left atrial enlargement. In left atrial enlargement we get bifid P wave, and the terminal portion of the uh, P wave in V1 is more than 1 mm deep or more than 40 milliseconds. Causes of left atrial hypertrophy are: in isolation, we usually see the left atrial hypertrophy in patients with mitral stenosis, but when it is associated with left ventricular hypertrophy, it can be seen in systemic hypertension, aortic stenosis, mitral incompetence, and hypertrophic cardiomyopathy. In this ECG, we can see broad more than 110 milliseconds bifid P wave in lead 2, and this is called P mitral with more than 40 milliseconds between the two peaks. So in this ECG, we see P wave terminal portion more than 40 milliseconds duration in V1. And we can see here P wave with terminal portion of more than 1 millimeter deep in V1. William Osler has said, a good doctor treats a disease, a great doctor treats a patient who has the disease. With this, I conclude my today's topic. Keep learning. Thank you very much.